How about the total iron and content in the body? Okay, looking at the total iron content in the body. Now, total iron content in the body, it is around 2.5 grams in females, and I told you it is 3.5 to almost 6 grams in the males. So this is the total iron content in the body. Now this entire iron is divided into two compartments. We have a functional compartment, and then we have a storage compartment. Functional compartment and storage compartment. So functional compartment is iron is actually functioning in the body. How is it functioning? So functional compartment has total of 80% of iron is in the functional compartment. Only 20% of iron is in the storage compartment. Out of this 80% of the functional iron is in the form of hemoglobin, and the rest 20% is distributed between myoglobin and enzymes. Now what are other enzymes? As I just told you, they are nothing but as catalase followed by cytochromes. So these are the enzymes. Moving on to the storage compartment, how is it stored? And I just told you the storage is in the form of ferritin and hemosiderin. I'll tell you in detail what is ferritin, what is hemosiderin, and how is it all stored in the body. So this is the two compartments. Functional compartment 80% of the iron, storage compartment 20% of the iron. Out of functional compartment 80% of the iron is in the form of hemoglobin, 20% and rest of it is in the form of myoglobin and enzymes, which enzymes? Catalase and cytochromes. And in the storage compartment we have ferritin and hemosiderin. And where is it stored? The storage is in the liver parenchyma, that is the hepatocyte cells, as well as it is also stored in the mononuclear phagocytes. Okay, also stored in the liver parenchyma and mononuclear phagocytes. Okay, so now what we have understood is that there is total iron in the body, and this is juggling between the functional compartment and the storage compartment. So the iron is juggling between the functional compartment and the storage compartment. Whenever the functional is less, it takes from the storage, and whenever functional is more, whatever excess iron we have got, it will go into the storage compartment. So this is how the distribution of iron in the body occurs. Okay, now we know that the intake of iron is done, and it is going to be absorbed in the body. Now we'll look at it, how is it absorbed in the body. Now before we look at how it is absorbed in the body, we'll look at its transport of iron. Okay, now whatever this free iron we have, remember, free iron, that is free Fe2 plus, is very toxic. Free iron is toxic, so it has to bind with something. So what is this something that you all thinking about? This something is nothing but as transferrin. Okay, this is the major binding protein of the iron that is transported in the plasma. What is transferrin? This is iron binding protein. And where is it synthesized? Synthesized in the liver. Okay, now we know about the transferrin. So what is the major function of transferrin? So if you look at its major function, what is the major function? It helps in delivering of Fe2 plus or Fe3 plus. We'll discuss it, how is it different. Delivering of Fe3 plus to erythroid precursors. What are erythroid precursors? Nothing but as those cells that will give rise to the RBC. So erythroid precursors for hemoglobin synthesis. for hemoglobin synthesis. And how does uptake how does this erythrocyte precursors uptake from the transferrin? They uptake because they have very high affinity. They have very high affinity for transferrin. So whenever transferrin moves into the bone marrow, due to their high affinity, erythroid precursors will absorb that iron from this transferrin. And how is it absorption? It is occurs through receptor mediated endocytosis. Receptor mediated endocytosis. So quick recap of the transport of iron. Free iron is toxic in the body, so it has to bind with something. Now what does it bind to? It binds to the transferrin. What is transferrin? It is that iron binding protein which is synthesized in the liver. Okay, and what does it do? The major function of transferrin is to deliver the iron to the erythroid precursors in the bone marrow for the hemoglobin synthesis. How does it uptake? Erythroid precursors have very high affinity for the transferrin, and they uptake through receptor mediated endocytosis. This is what you have to remember. Now normally this transferrin is only 1/3 saturated with iron. Okay, normally it is only 1/3 saturated with iron. Now if you calculate it, it comes around total serum iron level of approximately 120 micrograms per deciliter in men and almost 100 micrograms per deciliter in the females. Okay, this is the normal serum iron level. Whenever in iron deficiency anemia, the level drops to less than 20 microgram per deciliter in iron deficiency anemia, and it can go as high as more than 5,000 micrograms per deciliter in iron overload states. It can go as high as more than 5,000 microgram per deciliter. So this is about the serum iron level in the body. Okay, now next we'll discuss about the storage of iron. That is, I will understand you about what is ferritin, what is hemostatin, where does it store, and how is it properly regulated. Okay.